So hello everyone, my name is Sarah Newbery. I'm Chief of Staff here at the North of Superior Healthcare Group. Today's Friday, March 27th, and I am doing this video today on behalf of CEO Adam Brown to provide you with what we hope will be a weekly update, to bring information to you in the community and to ensure that we create an opportunity for you to ask questions and to know how to send questions into us. Today we really wanted to start by saying thank you to many of our partners locally who have worked really hard to support our messaging around self-isolation and physical or social distancing. Particular thanks to the municipality of the town of Marathon who declared a state of emergency this week, to Bigtagong First Nation and Atsagamik First Nations who've worked very hard to protect their populations this week, and to many of our corporate partners, Vallard, Construction, Barrett, Gold, who have made difficult decisions this week in support of their employees and in support of our communities. To Sherrard's Grocer, Canadian Tire, Home Hardware locally, to Costa's, and many of the other businesses in the Terrace Bay Scriber area, thank you for all that you have done this week to reinforce our message about the importance of social distancing and self-isolation as we make every effort to contain COVID and the risk that the COVID pandemic represents for our communities. Thank you to all of you. We wanted to take a moment and just reinforce what physical distancing or social distancing actually means, because we know that the more explicit that we can be in our communication, the more helpful it is. And we recognize that we've been using that language without actually being really clear about what it means. But we hope that through the other messages you've been hearing over the last week or so, you will have come to understand that physical distancing really means being separated by a distance of about 2 meters. So I like to think I'm 5'5". So my arm span is roughly 2 meters. And if people are 6 feet or 2 meters apart, that's a good, safe distance. Again, we recommend that, and Health Canada recommends that, because we know that the distance across which droplets can spread if we cough or sneeze is roughly 2 meters, so that if we're standing 2 meters apart, that's a helpful and safe distance for minimizing the risk of spread. Hand washing, 20 seconds, tops, sides, in between your fingers, wash your thumbs, wash your wrists. That's really important in terms of preventing the spread, as is coughing and sneezing into your elbow. So we're hoping that all of those messages are getting out to you. We wanted to share with you as well that there is an evolving volunteer effort in the community to make masks. These masks are being made, and I'm sharing an example today made by Pearl Giuliano here in the community of Marathon. They have the same shape as medical masks. They are not as good a filter as surgical quality masks, but they are terrifically valuable for people who are at home who will wear a mask to prevent them from coughing and sneezing and spreading COVID. So these masks don't particularly protect the wearer, but they protect the public if the wearer has to be out in public. So for example, this would be the kind of mask that we'll be offering to people who use the seniors van for transportation in the community, so that they will put it on before they leave their home, wear it while they're in the van and through the duration of their visit with whatever setting they're visiting, wear it back to their home and then take it off at home and place it in the laundry. So we thought, for the sake of reviewing, I would just do a little demonstration of how to put a cloth mask on and how to take it off. So this cloth mask has elastics that go over your ears. What we want to encourage is minimal contact with the cloth portion, especially once it's on your face and after wearing. So you put it on by placing the elastics over your ears. Ensure it's covering your nose. Pull the bottom portion under your chin, and then you don't touch it. So for the entire time that you're wearing the mask, you simply leave it in place. When you take it off, don't touch the cloth portion. Simply lift the elastics off over your ears, and when you're taking this off at home, we'll just drop it directly into your washing machine so that it can be laundered at high temperature and with good soapy water. So we're looking forward to having more of these that we can use to support people who are isolating at home and to support people who are caring for people who are isolating at home as well. That's the information that I wanted to share with you today on behalf of CEO Adam Brown and myself. And again, on behalf of the entire North of Superior Healthcare Group community, thank you for all of your support as we continue to prepare for COVID.